I went to university when I was 19, and my colleagues then used to tell me that the diseases that really people were afraid of were a variety of communicable diseases. Those days, we didn't think that much about non-communicable diseases. But now, 45 years later, this is serious business. And I think the statistics that have been rolled out, are very, very clear about this. And so I think it is important as we have the second conference on universal health coverage, we are now beginning to focus on specific sectors that are going to perhaps give challenge to the way in which UHC will be delivered. These are part of the 4 pilot counties that will be used to roll universal health coverage. And I want to kind of suggest that although funds may be made available to get everybody in those counties to be on universal health coverage, but as we proceed for the other counties, so that we are 47, I think maybe the emphasis should be how really NHIF is made a reality, how we target first and foremost the most vulnerable, because we could start in a way and abort this very, very, very important agenda because obviously after the first round, it might not be easy to keep on making the same monies available to now all the counties in the country. And for Laikipia, I think it's an important exercise of really making sure there is NHIF penetration. Also something that we are doing with AMREF in Makueni, where certain facilities are being targeted and poor people are being identified and helped, and others are being encouraged to register. I think we are getting remarkable results. Although we are piloting 4 counties, and we have seen, for example, the burden of NCDs and so on, it might be important for the national government to make funds available to the other 43 counties so that we can begin to do registration. We can begin to do a bit of infrastructure, equipment, planning, so that we don't have to wait until next year. I think the challenge of the NCDs is there's even now a shift. There's going to be a shift from the doctors, of stethoscopes, because now you need counselors, you need nutritionists, you need the social workers. As has been said, you need the community health workers. And even young people, like in Makueni, we have a youth service where those young people will be going like village to village, trying to help us with identifying who is, who needs attention. Also, we have development committees, in the villages. Those committees also doing the same work. Therefore, I think a Marshall Plan will be needed, and I'm happy here we have universities, we have researchers, because they have a major role to play.